Okay, so today we are going to do visual infusion phlebitis, that's VIP, and intravenous cannula flash. Okay, so I'm going to read a scenario. That's what we are going to use to perform this procedure. Okay, so you are the nurse in the medical unit. Please conduct a visual infusion phlebitis assessment and an intravenous cannula flash following the prescription chart below. So you need to complete the documentation of administered medication in a safe and professional manner. So what are you supposed to do? You're supposed to talk to the person, verbalize what you are doing and why to the examiner. You need to read out the chart and explain what you are checking, giving, not giving, and why. You need to complete all the required drug administration checks. You need to complete the documentation and use the correct codes. And the correct codes for non-administration will be on the chart. So this is a 12-minute station. The time is 800 and the date is today. So I'm going to start the procedure. I have a prescription on my phone, so that's what I'm going to read from. Alright. So I approach the scene. I check the environment, whether it's safe for my patients and myself. I need to check whether the environment is free from hazard. And I can confirm there's none. So I'm happy to proceed. So I'm going to provide privacy and dignity for my patients. If it's a hospital setting, we are going to provide privacy and dignity by pulling the curtains. But if it's a community setting, we are going to close the door behind to provide privacy and dignity. I'm going to perform a hand hygiene according to the WHO standard. So palm to palm, palm over dorsum, fingers interlaced, fingers interlocked, fingertip rotating, tongue rotating, wrist rotating, wrist rotating. I do my hand hygiene for 30 seconds, allow my hands to dry for 30 seconds, and I assume my 30 seconds has passed and I'm happy to approach my patient. So hello, I'm Winifred, one of the nurses taking care of you today. How would you like me to call you? Annie. Okay, Annie, as I said, I'm one of the nurses taking care of you today. And before I move on to the what I'm here to do, I would like to confirm your identity. Is that okay? Can you please help me with your full name and date of birth as I check against your wristband? Is that okay? Alright, so your full name, Annie Smith, right? Date of birth, 1/1970, That is okay. Hospital number is 00438. So I can confirm you are the right patient. Do you have any allergies? No. Okay, so my patient has no drug allergy. Therefore, this is my patient. And so, Annie, as I said earlier, I'm here to check your IV cannula size for any possible signs of infection. If there's any infection, I'll escalate to the doctor and also flash your cannula. You check the patency of it. Are you okay with that? Are you happy for me to do it? Yes. All right. So, Annie, I'm going to prepare the equipment that I'll be using for the procedure. Okay, so I'm just close by. If you need me, kindly call my name, okay? I'll perform my hand hygiene again and leave the patient bedside. The examiner, I can confirm that my tray and trolley is clean and ready to be used. I've been cleaned with detergent wipes, so it is safe to use. So I have my equipment here, which I'm going to name them and state the stability of it. So I have my gauze there, which is clean, intact. Expiry date is 15 January 2029. I have my 0.9% pre-filled syringe, which is not cloudy, it is clear. Examiner, can you confirm whether it's in date? In date. Alright, so I have my examination gloves here, which is clean and intact. I have my alcohol swab here, alcohol wipe, which is clean, intact, not exposed. Expiry date is February 2026. I have my apron here. And so my equipment are safe and sterile, so I'm happy to use it. Okay, so before we move on, I would like to read the prescription. Okay, so this is a hospital medication prescription and administration report for Annie Smith. Date of birth 1/1/1974. Hospital number 004382. Patient has no known drug allergy. So the drug is sodium chloride 0.9%. Date is today. Dose is 10 ml. Frequency is PRN, route is IV, duration is ongoing, pharmacy check. Start date is today, time is 800. Finish date is ongoing. Prescriber signature, bleep number present, pharmacy check. And you can see this is a valid prescription, so I'm happy to use it. Okay, so I'm going to approach my patient. And start with the IV check. Okay, so I perform my hand hygiene according to the WHO standard. I'm going to approach my patient and start with the IV check. Okay, so I perform a hand hygiene according to the WHO standard. Okay, so Annie, I'm back to start the procedure. Are you happy for me to do it? Okay, so for my hospital number 004382. Patient has no known drug allergy. Drug is sodium chloride 0.9%. Date today, time is 800. Dose is 10 ml. Frequency is PRN. Route is IV. Duration is ongoing. Pharmacy check. Start date today. Finish date ongoing. Prescriber signature bleep number present. Pharmacy check. So as I check the wristband, it corresponds with what is on the sheet. So this is a valid prescription. So I'm happy to proceed. Perform my hand hygiene according to the WHO standard. Okay, so Annie, I would like to check your IV cannula site. Okay, is that okay? Alright, so do you feel pain? Annie, do you feel pain around the IV cannula site? Here's my IV cannula. Do you feel pain around the IV cannula site? No. Okay, so I can see there's no redness, there's no swelling, there's no papal venous cord around the IV cannula site. So this VIP score is 0, and I can see that the site appears healthy. And so what I'm going to do is there's no signs of phlebitis, so that I'm going to only observe the cannula. Is that okay by you? Alright, so since there's no signs of infection, those signs of phlebitis, I'm going to flash the cannula to check the patient. Is that okay? Alright, so I'll perform a hand hygiene. I'm going to put on my PP. Okay, so I'm going to start the IV cannula flash. Okay, so I'm going to perform my hand hygiene according to the WHO standard. And on my PPs. I'm going to go on my apron. I'm going to clean the end of the IV port using aseptic non-start technique. Make sure that it doesn't touch the end of the bed. Okay, so I use the gauze to attach to the IV port so I don't contaminate it. Okay, I'm going to use this, that's alcohol wipe, 30% alcohol wipe to clean the end of the IV port for 30 seconds. Okay, so I'm going to clean it for 30 seconds and allow it to dry for 30 seconds. And assume my 30 seconds has passed, and so I'm happy to continue. So I'm going to attach my pre-filled water syringe into the IV pot using the water, and flash is using the pulsating procedure or stop-start procedure. So I'm going to unclamp it. Alright, so I'm going to insert it using the aseptic non-start technique. Okay. Alright, so as I'm flashing it, if you feel any pain, can you let me know, okay? So I'm going to push, stop, push, stop. Annie, do you feel any pain? No. Okay, so push, stop, push, stop. Annie, do you feel any pain? No. Okay, push, stop, push, stop. Annie, do you feel any pain? No. Any discomfort? No. Okay, so push, stop, push, stop. Annie, do you feel any pain around the side? No. Okay, so we are finally done. I'm going to dispose all items into the clinical waste. To the clinical waste. and perform a hand hygiene. So as long as I can confirm that my tray and trolley is clean and ready for the next use. So only I'm going to take my leave. In case you need anything, kindly use the call bell and any nurse will attend to you. Is that okay? So I perform my last hand hygiene. Okay, so I'm going to write date and sign on administration record. So I write my date and sign administration record. Okay, so as I'm going to do my last hand, palm to palm, palm over dorsum, fingers interlace, fingers interlock, fingertip rotating, fingertip, thumb rotating, wrist rotating, wrist rotating. I do this for 30 seconds and I assume my 30 seconds has passed. And I'm happy to end my session. Thank you very much. Bye.